This is Josh Mandel with a quick overview of our national interoperability strategy in the US from a patient perspective. So I'll try to answer the question, what does all this mean for me if you're a patient looking to make sense of all these rules and regulations, or maybe looking to find better tools to track and manage your own health? So I'll do a quick overview of our national regulations, show you some examples of the kinds of software tools that you can use to view and interact with your own health records. I'll do a quick treatment to help you understand where you can find your records and maybe give you a sense of what you can do with those records once you get them. I'll also talk about some gaps, so we'll review what's missing from the current landscape in some ways, and do a quick overview of some things that are coming next. And with that, let me dive straight into the national regulatory perspective. And this is just to set the scene. Back in 2020, we had a set of national regulations that came out that are really coming into effect this year. All this builds on a decade and more of investment in health IT interoperability. But coming by the end of 2022, we have some really interesting new capabilities, and these are what I'll focus on. The idea of what's called a Hl7 Fire Api, that is to say, an automated, consistent, interoperable way for patients to access their own records using any app of their choice. That functionality is supposed to be available by the end of this year. It's available for many people already, and there's going to be an interesting rush of development that's happening within the health record software to make this work. And then by the end of next year, additional capabilities to make sure that all of the data, all the electronic health information in a record is available for patients in an export format. So those are a couple of really important regulatory dates, end of this year, end of next year. And it takes a village to make all of this work. So I won't go into the great details here, but we have a national certification program where the software that clinicians use, the electronic health record software, needs to be certified, demonstrating that it meets certain capabilities like these API capabilities to share data back with patients. And you can get a sense of how many different software products are out there just by browsing this site and seeing there's over 800 certified products out there today. And then you can drill in with this tool and ask the question, how many of those certified products that exist today have certified for support to the what's called the patient API access criterion. So that's part of this Cures update. And if I search the page here, it's called Application Access, All Data Request, and Standardized API for Patient and Population Services. So if we zoom in that way, we can see out of those 800 different software tools, there are 26 that have been certified to date to support these capabilities, and that list is going to grow over the course of the coming months as vendors meet the deadlines that have been set at the national level. But even today, some of the biggest products out there, some of the most popular EHRs, have support for these capabilities built in. And I want to give you a quick sense showing my own personal health records of how some of this works. I'll show you two parts. First of all is the idea of a patient portal, somewhere that my healthcare provider makes available to me to come and see my own records online. And the portal offers a whole bunch of different functionality, including the ability to schedule new appointments or send secure messages to my doctor. But what I'll focus on for today is the idea of results and notes. How do the aspects of my health record that have been stored by my healthcare provider, how do those show up for me to see online? And so one of the things my portal lets me do is browse in and see the results of things like past blood tests to understand how my cholesterol lab results are doing. And I can also drill in and see from this history of clinical visits, I can see the clinical notes that were written after each visit. So these are here labeled as View My Visit Notes. And this is really interesting and important because not all data in healthcare is structured and computable. A lot of the clinical thought process and planning process happens in these kinds of free text format that includes a patient report, subjective statements, a therapist's observations. A lot of this can just be captured in text, and plan can be written in text. And so I highlight this just to give you a sense that these notes are in many ways just as important or even more important than structured clinical data like lab tests. You have to have them both in order to have a complete view of a patient's health history. And so these portals provide access to data in both of those formats. But even more interesting today is the ability for patients to access these data using any app of their choice. So it's great that I can sign into this portal and see my data in one place. But I also have to deal with the fact that my medical record is split across different providers. This one portal doesn't know everywhere that I've been. It doesn't aggregate all of my health history. But I can run an app on my own to be able to make those connections. And that's a big part of what our national investment in health interoperability supports. So you can have, under these new rules, any application of your choice and connect it to your health records. So it could be a web application like this Procure open source app that I'll show you. It could be a native mobile application like on Android, the Common Health app provides this kind of functionality, or on iOS, the Apple Health Records app provides this kind of functionality. There are many applications being built to help individual consumers or patients access their own records and make better sense of their own health history and coordinate their own care. I'll show you just a very quick example to give you a sense of what making that connection actually looks like. I'll show you the example using this open source web app called Procure. And in this case, I'm going to connect to the same healthcare provider that I was showing you in the portal view a moment ago. But you could go through this same workflow from Common Health or Apple Health Records to make a connection from any app you want into your health records. And in this case, you're asked to sign into your healthcare provider using an account that you manage with that provider. And then you're asked whether you want to approve access for the app that's connecting. And in this case, the patient portal surfaces some information about what that app is or who the app developer is. In this case, they've surfaced information reported by the app developer saying that they're not going to sell your data, they're not going to use your data for marketing or advertising, and they will let you delete your health data if you want. So as long as you're comfortable with this, you can continue in the process of approving access, and then you get to review the different categories or types of data that are being shared. The look and feel of these approval screens, the specific language that's used in them, is not regulated. So different patients may have slightly different screens that they'll be presented with at approval time if they want to connect an app of their choice into their health records. But what will be consistent is this ability to make sharing decisions category by category. So maybe I'm going to say, I'm willing to share many different kinds of information, but I don't want to share information about my medications or my procedures. So I have some ability to make those choices, and then I can make, at the end of the page here, a decision about whether I want to allow access or deny access. And in this case, I'm going to hit allow because I want to show you the next step of this workflow, which is I'm sent back to this app of my choice, and this app is able to fetch my clinical data, and it displays it to me on the screen here. And I won't go through great detail of what these data look like, but this is an example of an open source app that lets me create a spreadsheet or download a file with my own data in it. So if I wanted to track my cholesterol results over time, this might give me an easy way to do it using just a spreadsheet of my choice. So that's a quick example of what the connection process looks like. And it works the same way for a web app like Procure or a native mobile app like Common Health or Apple Health Records. All of these leverage the same standards-based APIs to connect to a healthcare provider using that same workflow that I just showed you. So that's a quick view of what it means to have access to not only a patient portal where your data live on the web, but also the ability to connect any app of your choice to those records. And it's worth saying, when I make this connection, some interesting things are happening. First of all the structured clinical data, medications, problems, allergies, lab results are flowing through those connections, as long as I've approved access to those data types. But also unstructured data, including clinical notes. For the most common types of notes, those visit summaries are also flowing through these APIs. And this is really important from a patient perspective. It means you can have a holistic view of your health record in one place. I will say this has also been, in some ways, controversial in the healthcare provider community. Historically, patient notes have been written in a way that isn't necessarily intended for the patient to read. So it can use medical jargon, doesn't always fully explain the clinical reasoning. And so there's definitely going to be some cultural shift and some adjustment to making these kinds of notes work in a way that they are useful for clinicians as well as patients. And I think we should expect this is going to be, in some ways, a slow process of cultural change. It might take a few years for these kinds of details to settle out. Maybe healthcare providers are going to start writing notes in plainer language. Maybe they'll start explaining more of their reasoning. Those might be some positive benefits of this shift to open notes. There are also concerns that maybe healthcare providers will become more cautious in what they document. So there could also be some negative consequences. And as a society, we're going to have to work through this process of cultural change. But patient access is a right, and it's here to stay. And working through these aspects of what it looks like to share notes is going to be an important part of this story. So let me spend a few minutes to talk about how to find my records. And in the examples that I showed you, I just sort of already knew where those records lived. I happened to know the name of my healthcare provider, I knew where their patient portal was, and I made the connection directly. But in practice, your health records might be spread across more than one provider. you might not remember where that healthcare provider's website is. And today, the process of making these connections still leans heavily on a patient remembering or being able to find those details. So for example, some of the EHR vendors offer their own kinds of discovery tools. So like my healthcare provider in Madison, Wisconsin uses Epic as their EHR system, and Epic hosts a website that lets you kind of search for providers that use Epic. But these kinds of search tools are also going to be available from any healthcare provider that works with the standardized APIs, and applications will be able to pull these data feeds in to help you search for your healthcare provider by location. So maybe you know that you have a healthcare provider in Madison, Wisconsin, and you'll be able to search for it by location, by name, perhaps by the name of your doctor. There's a lot of details here that are still not as smooth as they need to be, but there's work underway to help make this more straightforward. Some of that includes things like provider directories. So if you know the name of your doctor, you might be able to look them up and see which practices and health record systems they use. Another part of this puzzle could be more national investment in centralized infrastructure. We're building out something called a data query network or trusted exchange framework. Lots of work here. If you're interested more in this space, please send me notes in the comments or reach out to me directly. I'm happy to talk more about sort of what's coming on that front. So from a patient perspective, I've got my data. Maybe I've been able to link multiple healthcare accounts into my app of choice. What can I do with it all? And I think we're still in the very early days here. So we have some apps that are really focused on just record keeping. Give me a place where I can see and view and make sharing decisions about my clinical history. Maybe I want to be able to coordinate care. So family members who are helping me with my healthcare can keep track of what medications I've got. So that kind of sharing functionality becomes important for coordination. But I think it's still very early days. We're going to see a lot more apps that are focused on taking better care of health. So how can I take better care of my hypertension, high blood pressure, or diabetes? What are ways that I can find communities of my peers out there who have similar problems and who want to work with me on strategies that might be effective? How can I donate my data for research? How can I find the right specialists to visit if I'm having a healthcare problem where I haven't gotten a good diagnosis or where I'm still looking for the right sorts of treatment? I think that over the coming years, we're going to see a lot of innovation in this space. Today, a lot of the apps are focused on the bookkeeping functionality, but even things like finding and scheduling appointments or finding the right specialists or price comparison between different insurance plans, these are things that are going to be of near-term value for individual patients and healthcare consumers. That said, what's missing from these APIs today? I showed you examples of how to see clinical notes and medications and problems in labs, but there are still some very important data types that are missing from the equation. One of those would be imaging data. So for example, when I had an MRI study done a couple of years ago, I was able to get the clinical note from these APIs, but I was not able to get the actual DICOM images, the MRI pictures themselves, as part of the data that I could access. So that's an example of a data category that's still missing. I think we'll see more as the national investment ticks on. So every year in this framework, new data elements will be added to what's called a core data set for interoperability. And so we can expect that the data access will continue to expand year over year with new data types. There's also various kinds of functionality beyond just seeing your data that might be important to be able to do from a third-party app or from any app of your choice. So one of these might be scheduling. How can I book an appointment from a healthcare provider to make sure that I have a convenient way to find available slots and pick one that works with my calendar? Another one might be corrections. So if I spot an error in some of the data that I access through these APIs, how can I correct those things? And today, the answer to these kind of questions is, well, for the data types that are missing, we're going to have to work as an industry on making sure that the standards are consistently supported. But for some of these other kinds of functionality, like scheduling and corrections, these are available today through patient portals. So you might not be able to do this patient scheduling inside of an app of your choice, but you can still go to your healthcare provider's portal and sign in and schedule an appointment using the kinds of interfaces that are offered here. Or if you spot an error in your medical record, you can go to something like the message center to do secure messaging with your healthcare provider, again, through that portal. So this is kind of an incomplete picture, but it represents where we are today. There's some functionality that you can do in any app of your choice, and there's other kinds of functionality where you might still have to go to your healthcare provider's portal to get into that level of detail. And I think we'll see those API capabilities expand over time. A couple other notes about what's coming in the future. One is, I mentioned early on, beyond this core data set, patients have a right to access all of their health data, and the regulations that we have at the national level support this. So by the end of next year, there's going to be some patient-facing functionality to do what's called a full data export that covers all of the electronic health information in their account. It might not all be standardized, but at least it'll all be available for you to export and download. We're also seeing investment in API access to insurance claims. So if you want to get a sense of your healthcare financial health, if you want to understand what you're spending money on or what your insurance plan is spending money on with respect to your care, you can make connections to access these same kinds of data from your insurance plans. You can get a sense of what benefits you've received, how much those various things have cost, both to you as well as to the plan. And there's some additional functionality coming to make it easier to find which healthcare providers participate in your insurance plan. So things like online provider directories that are kept up to date. All of these are going to contribute to a more seamless ecosystem for patient access. It's still very early days, and roughly speaking, I would kind of put a little dividing line here and say these are the things that are kind of working today, helping patients access their own records. There's a lot more that's coming, and I don't think we should expect all of this to be working out of the box in 2022. We need to have some patience, we need to have some vision for how well things ought to function in the future, and it's very important to share your experience. So get involved in communities like the chat.fire.org site. There's a patient empowerment work group stream there where you can share some of what's working for you, some of what's not working for you. And the important thing is that we keep our eye on this sort of long-term vision of what a consumer-centric or patient-centric ecosystem ought to do for us, and we keep working to close those gaps. So I'll wrap up for today. Please feel free to ask me any questions in the comments or reach out to me on chat.fire.org, and I will see you there.